This is a very difficult issue, as the living kidney donation is a precious gift that only the donor can decide in the hearts of hearts in order to help somebody to improve the life and to prolong the life. It has to come from the goodness of the heart, and it's an act of love and an incredible gift, and we cannot ever forget this. And this is what makes it very difficult for a recipient to ask for a kidney. It is very difficult to ask for a kidney within a family, and it's very difficult to ask friends, because everybody is aware that you're asking somebody to undergo risk that includes the risk of death in order to donate the kidney. There are a couple advices that I always give our patients. One is that disinformation and misinformation is the major deterrent to kidney donation. People have very odd misconceptions about what it takes regarding the risks as well as what it means to the donor. I always advise the patients to come to the initial appointment with as many family members as possible and identify one of the folks that accompany you as an advocate. It is very difficult for a person to ask for a favor for themselves. It is much easier for another person to spread the information, and evaluation for a kidney transplant can be a good talking point to start the conversation about the need of a particular patient to obtain an organ. A lot of times I hear from my patients that as soon as they spread the information, a lot of friends and family members came by and say, "Oh, I never knew that you need a kidney. Why didn't you tell me this?" A lot of folks are too private. On one hand, you can't ask for this favor because only the donor can decide it in the heart of hearts, but you cannot be shy of telling people that you need a kidney. And this solves a lot of offer issues for patients already. Another thing is to spread the news among friends. We have the tools now like Facebook where you can announce to the world pretty much that you are in the need of kidney, and this allows people in their heart of hearts to decide if they want to give a kidney to you without any undue pressure. This method has become more and more popular among our patients and has resulted in a lot of people receiving kidney transplants. Another widely untapped resource are faith groups, religious groups, churches, where the word can spread very quickly about the need of a patient of a kidney, and we have transplanted a lot of folks that way. Another issue that people are having is to not wanting their children to donate a kidney. This is a very natural instinct for a parent not to want to put their children in danger. But parental oversight ends at some point, and I always point out to my patients that the role as a parent ends when the children become adult, and one has to allow the children to make their own decision. You always have to think about this. If it were your parent who is in need of kidney, would you not be upset if that parent decided that, oh, I will have a shorter life without a kidney transplant, or accept your gift and share my life with you for a longer time? This is a very, very difficult problem, but I would always urge people to keep their mind open. This is the most difficult part of talking about the living kidney donation, is the open mind. We have created a very good system in which the donors are afforded maximum privacy protection, and I remind people all the time that the donor evaluation process is not an agreement process. This is a process that's designed to bring information to the potential donor. It has nothing to do with being already a donor candidate. This way people can obtain their own information on their own time, ask questions without the undue pressure of having to donate a kidney to somebody.